Welcome to SG Health and Wellness guest series. I'm Swati, Doctor of Natural Medicine and Holistic Nutritionist from Minnesota University, Australia. Today's episode marks the first in a 5 episode series all about liver disease. The expert guest for this series is Dr. Ajitabh Srivastava. Dr. Srivastava is a gold medalist in multiple subjects during his MBBS studies and has received the prestigious Best Registered Award at Sir Ganga Ram Hospital, New Delhi. He has over 18 years of experience in HPB surgery and liver transplant, beginning in 2005 while working with India's top doctors. He is trained and worked at prestigious Indian institutes such as Sir Ganga Ram Hospital, Apollo Delhi, and Medanta Medicity. He is a founding member of the Transplant unit at Apollo Delhi, Apollo Chennai, and MIOT Chennai. He has taken part in over 1,500 liver transplants, including living donor, deceased donor, pediatric, and combined liver and kidney transplants. Over the course of this 5 episode series on liver disease, Dr. Srivastava will teach us about the various types of liver diseases, their causes, symptoms, and how to take good care of our liver. We are truly honored to have Dr. Ajitabh Srivastava with us today. The main discussion in today's episode is fatty liver. During our conversation, we will be discussing the causes and prevention of fatty liver disease as well as some valuable tips for maintaining a healthy liver. So stay with us, and if you have any questions during this episode, please feel free to share with us. Without further ado, let's welcome Dr. Srivastava. Dr. Srivastava, welcome.
Thank you, madam, for the introduction. And I think so. First of all, I should congratulate you for the initiative that you have taken in promoting and making the population understand about the preventive aspects of taking care of the health and focusing on the holistic approach in their overall well-being, which is of paramount importance in today's era when our lifestyles have become so sedentary, and majority of the illnesses these days is related somewhere or the other to our lifestyle.
Can you please tell us about your current role and responsibility?
Madam, I'm a surgeon. I'm a hepatobiliary pancreatic GI surgeon and specialize in liver transplant. So currently, I'm holding the position of a senior consultant and the chief surgeon at Department of GI Surgery, HPB, and Liver Transplant at Akash Healthcare Super Speciality Hospital, Sector 3, Dwarka.
As we mentioned earlier, today's episode is all about fatty liver.
Yes.
So, Dr. Srivastava, can you please explain to our listeners what fatty liver disease is and why it's a matter of concern?
So, madam, first of all, I would like to say that as all of us know, India is turning out to be the diabetic capital of the world. We have the largest number of diabetic patients in India. And diabetes is one of the risk factor for development of fatty liver disease. So somewhere or the other, fatty liver disease in today's time is turning out to be I will say, a epidemic where people need to have an understanding about the preventive aspects. Otherwise, with time, with the fat in the liver, the liver disease incidences will really go very high in India, and it is high time that we take corrective measures for the same. So, fatty liver disease is one of the a very important aspect of say it is a area where every individual need to be careful of, because liver is an organ which is known to be a very resilient organ, and a person doesn't realize that he has a liver problem until liver has become almost 80 to 90% damage. The symptoms of liver disease will come up only once the liver is close to 80% damage. And once the symptoms of the liver disease come in, which I will enumerate in the later part of my discussion, then it is too late.
So
Okay.
diabetes is the main cause of fatty liver.
It is one of the factor for the liver disease.
What are the other
Where,
causes?
yes. So first, let me explain to you what is fatty liver disease.
Correct.
So fatty liver disease is a terminology which is given to when the fat is identified in the liver and there is a fatty deposition in the liver. The causes of fatty liver disease in olden times were reported as an alcoholic liver disease, alcoholic fatty liver
Fatty liver.
disease, and non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease was an entity which was given for patients who had fatty liver disease because of non-consumption of alcohol. Now, the definition or the terminology for a non alcoholic fatty liver disease is changed to metabolic associated fatty liver disease, which includes the other causes of, like, say, it is mainly a metabolic syndrome where a person may be diabetic, a person may be hypothyroid, a person may be obese, okay,
Yes, yes.
and obesity. So the main causes of non-alcoholic fatty liver disease. In today's discussion, we will focus our discussion mainly on non-alcoholic fatty liver disease. Alcoholic fatty liver disease is by a topic by itself. Again, the way it would have its further ongoing pathology would be the same. The way it would damage the liver would be the same, but the etiology of deposition of the fat is different in both the entities. Okay, and the preventive measures for both the entities would be different, because for alcoholic liver disease, prevention of the alcohol would be the most important thing, and our non-alcoholic fatty liver disease will have its own etiology and own ways to prevent it.
Okay. What happens if fatty liver disease goes untreated?
See, first of all, the identification of fatty liver disease is mainly by your screening, because a person may not have, because it doesn't lead to any symptoms. And by itself, fatty liver disease may be, like, say, I think so, it is at times overdiagnosed also, because it is by a simple even investigation like a plain ultrasound. Many a times, our viewers must have got reports, or they must have heard about reports where it is mentioned that there is grade 1, grade 2 fatty liver disease. Okay, so it is a screening which is done, because symptoms wise patient may not have any symptoms. Okay, but that also is an overdiagnosis. And many a times, ultrasound may not be the best modality to confirm the fat in the liver. But yes, whenever there is any change in the signals, what the ultrasound probe is sending to the liver, and that may be interpreted as a fatty liver disease, and our radiologist would mention as grade 1 or grade 2 fatty liver disease. So again, the main thrust of identification of fatty liver disease is your screening. Okay, so first of all, it is important to know who are the people who carry a risk to
High
have
risk.
fatty liver disease.
Correct.
So to understand that, it would be important to know what are the etiology of fatty liver disease. So to enumerate the causes of fatty liver disease, the first of all is people who are obese.
Obese.
Okay, as fat is deposited in rest of the body, even fat gets deposited in the liver. The second is diabetes.
Diabetes.
People who are diabetic, they may be lean. They may not be fat, but because of diabetes, because of insulin resistance, which is the cause for development of fatty liver disease, development of diabetes, may be the same pathology which may be responsible for deposition of fat in the liver. Okay, then the other etiology is people who are hypothyroid. They may be having, they may be overweight, and then that could be one of the reasons for it. Some of the medications or some of the say some of the factors which could be heavy on the liver, like say some people may take say some over the counter medications or some Ayurvedic preparations. So those are the things which can, because of heavy metals, because of it will cause insult to the liver, and that insult would be manifested in the form of deposition of fat in the liver. Okay, then the other causes for fatty liver disease would be people on steroids. Okay, taking steroids for various illnesses, like say nowadays there are a lot of allergies, lot of autoimmune problem, rheumatoid arthritis. So they also have the tendency of deposition of fat in the liver. So now what happens once the liver is fat is deposited in the liver, as you can see in this model. Okay, so the fat first would get deposited in the liver. The cell fat within the liver will lead to local inflammation. Okay, and that inflammation will cause some changes in the liver function test in the form of rise in the SGOT, SGPT, or which is also known as AST, ALT. So there would be there would be an indirect sort of pointer that there is something wrong going on in the liver, where there would be transaminitis would be there. So this inflammation in the cell will further progress to fibrosis in the liver, like healing in any part of our body. Like say if I develop a cut here, so how it would go about: first there would be swelling, there would be inflammation, and then that cut would be healed by scar with the fibrosis. Okay, in the same manner, once the insult is there in the liver, once the damage is there in the liver in the form of deposition of the fat, that would reflect in the form of inflammation. Then inflammation will change to fibrosis. The fibrosis would be in various stages, stage F1 to F5 fibrosis, F6 fibrosis. And this fibrosis will further progress to cirrhosis of the liver. Now the catch is, up to F3 fibrosis, if the corrective measures are taken, the liver rebounds back to its normal health. Okay, it completely recovers. With medication? With medication and all other lifestyle modifications and all. Okay, beyond F3 fibrosis, then there is a permanent damage to the liver. By taking corrective measures, this damage to the liver may be put on a halt. It may not reverse back completely, but that further rapidity of progression can be taken care of by taking the corrective measures. Okay.
So up to 3, that is
up to F3 fibrosis, it's okay. Beyond that, then it goes to further progressive damage to
and
the
which is
liver.
called liver cirrhosis, right?
Then it is known as liver cirrhosis.
We will come
Some people of who develop liver cirrhosis may need a liver transplant. So at the same note, I would like to say, in today's time, non-alcoholic fatty liver disease is one of the commonest indication for patients who are needing a liver transplant.
Okay.
Okay, so
It's
now
a new
you can,
information.
yeah, you can understand now what is the overall sort of importance of this entity.
Correct.
Okay, now coming to a question of how can you identify that a person has got a fatty liver disease?
Correct.
Okay, so if anybody has got this risk factors, okay, like a person who's a bit on the
Yes.
heavier side, diabetic,
Diabetes.
taking steroids,
Mm-hmm.
taking medications where it is on a long term basis, or steroids. So these are the group of people who need to get themselves evaluated on a regular basis to check whether they are developing fatty liver
Fatty
or not.
liver.
Okay.
Okay.
And if they are developing fatty liver, then they need to take the corrective measures. They need to consult their doctor who's
Mm-hmm.
treating them. They can consult a expert in liver disease. Okay, someone taking care of the liver disease, someone like us. Okay, they can come, they can talk to them, they can take the advice and start with their corrective measures. Okay, so now how can a person confirm whether he has got a fatty liver disease? As I mentioned to you, ultrasound is just a screening. Okay, and
Mm-hmm.
many a times it could be wrongly diagnosed.
Mm-hmm.
Okay, how can an individual confirm whether he has got a fatty liver disease? So, first of all, um, uh, doing a liver function test
Okay.
and identifying if there is any rise in the liver enzymes, checking for the diabetes, do HbA1c
Yes.
to know how the sugars are there for the last 3 months,
Mm-hmm.
to confirm the other metabolic causes so that we identify the etiology.
Mm-hmm.
Then about imaging. Imaging, how to confirm whether the fatty liver is there or not. Ultrasound, yes. In an experienced hand, ultrasound would be quite uh, quite helpful in confirming whether a fatty liver disease is there. Ultrasound is a modality which is it varies, and centers who have experienced radiologists who are doing it, they can really pick up and they can give you the right information whether the fatty liver disease is there or not. The other objective way to know whether the fat is deposited in the liver is by doing a fibroscan. Fibroscan gives you two values. One is a KPA score, one is a CAP score.
Okay.
CAP score gives you an idea whether there is a fat in the liver. If anybody having a score more than 220 or 250 suggests that there is fat in the liver. Okay. Or KPA score, as I mentioned to you, liver stiffness is identified by this KPA score on fibroscan. Anybody having score more than 6 is suggesting that there is some fibrosis building up in the liver. The other modality to confirm would be, which is more confirmatory, is doing a MRI. MRI spectroscopy is one of the good modality to identify what is the percentage of fat in the liver. Okay. And yes, liver biopsy is a gold standard to identify whether the fat is there in the liver. But liver biopsy is more of a invasive test, and it is generally not required to confirm. We who deal with liver transplants, when we are taking part of the liver from a donor, live donor, and whenever there is a suspicion of fat in the liver, to confirm how much of the percentage of fat in the liver is there, we get the biopsies done for the donor as and when required.
Is there any misconception about fatty liver disease?
Yes, many a times a person may feel that just on a radiology, if the fatty liver disease is there, they get apprehensive. The misconception may be that fatty liver disease is a incurable treatment problem. There is a misconception that it is life threatening. Okay,
Mm-hmm.
so it's important that through this discussion, what we are having today, we'll try to clear out these myths and doubts in the mind of our viewers.
So, do you have any patient success stories? You must have.
Yes. So, first of all, before that, I would like to say, as I mentioned to you, that fatty liver disease is a completely curable problem.
Curable.
Okay. And I always say that the treatment of a person having fatty liver disease is primarily having a four pillars. Okay. So, the first pillar is nutrition. Okay, taking healthy, balanced, nutritious diet is the most important thing.
Yes.
Okay, where you need to cut short on your calories, you need to cut short on your
Processed foods.
overall processed foods, junk foods,
Correct.
because anything which will increase the calorie intake needs to be put on check. And anybody who has been identified that he has fatty liver disease, they have to take the corrective measures at a war footage. They need to take it very seriously, and they need to get themselves in on the correct path as early as possible.
Red meat is harmful for
Huh?
them. Red meat is harmful for them.
Red meat only when a person develops advanced liver cirrhosis.
Okay.
Okay.
Otherwise,
And then otherwise, because once a person has developed an advanced liver cirrhosis, liver is not able to metabolize certain toxins,
okay.
which sometimes red meat may be causing, like ammonia.
Mhm.
So that ammonia can hit the mind. For a person who just have fatty liver disease, it is not contraindicated. Red meat can be taken. In fact, taking good protein diet is something which is of paramount importance to help the liver regenerate. As I mentioned to you, liver is a very resilient organ. It takes on the insults and the damage silently without telling an individual that the liver is getting damaged. And and the same note, once the corrective measures are taken, liver rebounds back to a healthy liver in no time. Okay, so the first pillar is diet. The second pillar is exercise. Lot of time what happens, Mrs. Ghosh, that people feel that, just I've seen so many people in the park, they just stroll around and they say that आज मैं 1 घंटा चला, आज मैं 45 minutes chala. But when we talk about exercise, it has to be exercise as in strong, thorough exercise, aerobic exercise. A person needs to sweat.
Strenuous exercise.
Okay, strenuous exercise. They need to sweat, they need to have a proper aerobic exercise. Correct. Even if it may be for 15 to 20 minutes a day.
Or
Okay,
thrice or
but it needs to that a person's heartbeat needs to double.
Correct.
Okay, needs to, like, say that has to be the level of exercise which is required as a cure for fatty liver disease. So the moment a person would try to do this, and that there has to be a target of weight loss. A person who is of a higher BMI needs to try to get to that normal BMI range of 20 to 24. Need to have a target weight. Suppose if my height is 180 centimeter, 6 feet, my ideal weight is somewhere around 80 kg. If say I'm weighing 90 kg, I need to come down and get to my ideal body weight. Correct. And that has to be the target a person needs to maintain. Okay. So the first pillar was nutrition, balanced diet, cutting short on the processed foods, junk food. The second pillar is exercise. The third pillar, which is of importance, is good sleep. Many a times what happens is that people in their these days, because of so much of stressful life, the anxiety, social media, they don't have good night's sleep. Correct. So what happens is that once the sleep cycle gets affected, our body starts building up. Like, say, ghrelin is an endotox, is an endogenous hormone which is produced. Okay, which is at times it suppresses our satiety center. Exactly. Okay, so once a satiety center is suppressed, a person continues to eat more. Okay, and having a good sound sleep will somewhere control the production
Hunger,
of
yes.
this, and it will have its effect in correcting the fatty liver disease.
Mhm.
And the fourth important pillar is controlling on your anxiety, on your nerves,
Stress.
and stress, and having regular, like say, meditation, trying to keep yourself calm and
Mhm.
cool is an important part in the treatment of fatty liver disease.
These all are basically the treatment of overall health.
Overall health.
Overall
As I
health.
mentioned to you, these are all lifestyle related problems.
Correct.
And the important part is the moment the corrective measures are taken, it reverses back, it rebounds back to an extent where a person may not have fat, like it doesn't have fat at all. Now, coming to your question on what are my success stories,
Yes.
okay, there have been lot of success stories, Mrs. Ghosh, where we have had patients who were disciplined and who have their fat has completely disappeared from the liver. Say, I am a doctor who does liver transplant. So we do have patients who do come with a donor, and having the donor safety and having a donor who's fit to undergo the surgery is of paramount importance. Okay, live donor transplant is when you take a part of the liver from a live donor and give to a person who has got a liver cirrhosis, advanced liver cirrhosis. You take the bad liver out and give part of the liver to the patient. So now the surgery for the donor is near 100% safe. And when the donor's liver is normal, then only it would be safe for the donor. If due to some reason there are certain factors which is not normal in the liver, and doing a donor surgery may not give you that desired outcome in the donor where
Correct.
you want 100% safety.
Mhm.
So across the program, if across the program in the globe there is no program who do live donor transplant will accept a donor who has got borderline liver or there is any risk factors attached with the surgery for the donor. Okay, so one of the factors for the donor to get rejected is having fatty liver disease.
Mhm.
Okay, so there have been success stories where within 3 months, where patients have gone through their aggressive diet and exercise schedule, and their fat from the liver has completely disappeared. So we had there are a lot of patients, but I distinctly remember one patient who is in his mid 20s, and he was donating, who came to be a donor for his brother. Okay, when he came to us, he was weighing 90 kg, and his height is around 170 centimeters, and so he was almost 20-30 kg more than his desired weight, 20-25 kg. So then we did his evaluation, and we came to know that he has got fat in the liver. We did the further evaluation, and the fat in the liver was estimated to be close to 40% in fat in the liver. When I say 40% of the fat, means of the whole liver, 40% of the liver was having fat.
Oh, wow, wow.
And to be safe for a donor surgery, the fat has to be less than 5%. Up to 10% is okay if the volumes are fine, but not more than 10% for a live donor. So now the patient was having an estimation where he had a fat in the liver of 40%, where we got the MRI spectroscopy and we got the CT scan also done. Then we put him on exercise and diet schedule. He went on that intermittent fasting type of diet, GM diet, where he was only on fruits and water, and like there is a specific diet schedule. He went aggressive on that. He he started exercising regularly. he was very much motivated to save life of his brother. Okay, so it all zeroes down to the motivation. We did advise him, but advice is given to lot of people, but not everybody follows. So in months to follow, we started seeing change in him. His body weight in 3 months' time from 90 kg came down to 69 kg. He lost 20 kg of weight in 2 to 3 months' time. His fat, which was close to 40%, it came down to less than 8%, 6 to 7% fat. And we were able to take him up for donor surgery, where we took out the right lobe from him and we gave it to his brother, who was suffering from a end stage liver disease. And his brother did have a smooth recovery, and the patient also, the donor also, had an uneventful recovery, and he made like this is one. If I could have shown you the pictures of the donor, that would have really given you that impact of it.
I can show you
Yeah.
a person sitting in front of you.
Okay.
Did the same.
Wow.
Within 3 months,
Yeah.
she lost more than 10 kgs.
Wow, it's
And-
amazing.
and
Amazing.
from
This is
grade
good.
2 or grade 3 to no fatty liver at all.
Wow. So
I did.
we have an example in front of. So this is a donor. We have his photo after that also. So this is the person whom I was talking about.
Oh,
This
great.
was his. See how fat he was,
Oh my God.
and before the donation,
Oh,
he came down to this.
amazing.
Okay. So this is something like, and then I could have shown you the imaging of fat and all. Like, so if a person is determined,
Correct.
like that
Motivated.
is what I mean to say. This is a disease which is a silent killer. Corrective measures and meeting the right team of doctors and the healthcare professionals, okay, which is you as well. You advise on the dietary advice, and like so.
I only did through the diet and proper exercise.
Amazing.
That is my
Amazing.
regular
I think
routine.
so. Losing weight is the most difficult thing
Exactly,
to do.
exactly.
Because it
And
needs
maintain, and the
and
most
maintain
important,
it.
consistency. That is
Yes,
the most
yes,
important thing.
yes.
Every day I take the same boring food, only protein, maximum time protein, carbohydrate, no carbohydrate mostly.
Okay.
So,
I think
that
so.
is-
That's
that is
about
for
it.
overall health.
Overall
we
health,
need
it is
that
the
actually.
most important.
Exactly. Whether it is fatty liver and
It is cardiac, it
anything
is heart
else.
ailment, it is
Exactly.
diabetes, it is your other
Even for eyes
joint,
also.
for
Even
your
eyes
eyes, for whole body. No,
Like
no,
that.
I think so. It holistically helps the body,
Exactly. Exactly.
and you start feeling younger. That is the most important
And
thing,
happy also.
and happy also.
Thanks to you for giving me so much of your precious time.
Thank you very much for giving me an opportunity to talk to you through you, talk to our viewers, and
We
giving
will
them
continue
the
this
yes.
series. Thank you so much all for joining us today for our discussion with Dr. Ajitabh Srivastava. And if you enjoyed this podcast, please subscribe to my channel. Thank you so much, Dr. Srivastava. Thank
Pleasure.
you.
Pleasure.
Thank you. Thank you
Yeah.
so
Okay.
much.